breast cancer, they had some biopsy and probably needed some surgery and all this. What is next? Because in a cancer, it's a totally different life paradigm shift.
Yeah, it is a definite
shift in the life paradigm.
experience for women because some women, they just have the surgery and they think, okay, the surgeon took out the cancer and that is the end of it. And they are kind of shocked when we discuss with them what are the other steps they need to take. Not only to prevent recurrence of the cancer that they had, but also when all the treatment is done, that they need to be still aware of preventing or minimizing or diagnosing early cancer in the other breast.
I see. Oh, okay.
Because women who have cancer in one breast, they have 3 to 4 times the risk compared to normal population of developing cancer in the other breast. So they need to have regular examinations, regular mammograms of the other breast, and if there is something abnormal found, then that need to be treated just like it was in the first case.
That's very interesting. Let's take just 1 minute break here so that we'll come back and we'll continue with the conversation. Let me figure, these computers have their own brains here, unfortunately. Okay. Ladies and gentlemen, please visit All India Radio Facebook and watch the previous interviews and other interesting clips. We have more than 300 videos covering various aspects of Indian experience here in Houston and from around the world. So please visit YouTube and subscribe to All India Radio Houston page so we can keep you updated as to the latest additions to our video blog. Okay, ladies and gentlemen, we are back. I'm Dr. NIK NIKAM. You are listening to NIK NIKAM Network Talk Show. The name has changed, of course, and we are talking about breast cancer awareness and treatment and diagnosis. My special guest is Dr. Arvind Bhandari. Let's give out your contact information one more time so that we can talk about prognosis, you know, how.
Yeah, my office address is with Texas Oncology Cancer Center, 1350 First Colony Boulevard in Sugar Land, and our office number is 281-277-5200.
Okay, let's talk about prognosis. I have heard some of patients who come to me, you know, in their 50s and 60s, they say, I had breast cancer 10 years ago, 15 years ago, and I had surgery, I'm doing fine. So that's probably the best news anybody can hear. Maybe you can tell us what is the prognosis of people who you diagnose breast cancer.
Yeah, so the prognosis obviously depends on the extent of disease or the stage of the disease. But then within the same stage also we have now many different prognostic factors that will determine as to how aggressive the cancer is and how the treatments are tailored depending on those prognostic factors. So obviously the best scenario is where somebody is diagnosed to have breast cancer on a routine mammogram and it was very small and the patient had either mastectomy or partial mastectomy with radiation. And many of these patients, they are also given either treatment with anti-estrogen medications for about 5 years after the initial surgery, or in some cases, or in many cases these days, they also get preventive chemotherapy, what we call as adjuvant chemotherapy, which is usually given for about 4 to 6 months. And after that, they still are monitored. So patients who fall in the first category, where this stage 1 cancer, they have very high chance of cure rate, and the cure rate for 5 years could be more than 90%.
That's pretty good.
But in some of those cancers, and we can tell that in the beginning when the tissue from the breast tumor is analyzed, whether this cancer is going to be more aggressive. To give you an example, if the cancer does not have the receptors for estrogen and does not have receptors for progesterone and has a mutation called HER2 neu, and these cases are called triple negative breast cancer. And these are very aggressive
Yeah.
kind of breast cancers, and even when they're detected in early stages, they have high chance of recurrence that we have to monitor a lot more closely compared to some of the other ones.
So you will be able to differentiate these people from the regular
Yes.
breast cancers.
Yes.
So the message I understand is all breast cancer starts off with one or two abnormal cells.
Yes.
The earliest we detect, there's a pretty high chance of getting rid of the cancer altogether.
Yes. Before it has chance
Before
to
it
spread.
it
All right.
spread. And if you were to come in like stage 4 or something where it has already spread to the bone or the lymph nodes and all this, then the prognosis is pretty poor, which could have been very excellent if it was detected early.
Definitely. Definitely.
So early detection is of more importance
that is the key.
than diagnosing in the later stages, unless they have the one we said where there's triple negative.
Then you
that we
can't
can't do much.
So that's one message that I like to
Yeah.
sort of get to, especially Indian women,
Yeah.
is to be aware of this and do self-examination, have regular checkups,
Yeah.
and have regular mammograms.
Okay, you have any special advice for the Desi population as far as breast cancer is concerned?
Yeah, I think the main message that I like to give is that many women tend to be shy,
Yeah.
or especially in women who are in India, not
That's
as much as here, but still
Yeah.
that could be a social factor, and they need to be aware of it and do self-examination, have examination by the physician at least once a year,
Yeah.
have mammograms starting at the age of 40, and have it every year. And if there is anything, and if there is any lump palpable, and woman can tell herself that
I
okay,
see.
one side does not feel
Yeah.
the same as the other one, to have that checked, and if in doubt, have a biopsy to prove it one way or the other, because all the lumps are not cancerous.
I see, yeah.
Because some women, if they feel something, they're so scared that it's
Yeah.
going to be cancer that they don't go to the doctor.
Yeah.
So the best thing is to have it checked out,
Yeah.
have the peace of mind
That's-
that with the biopsy, if it is not cancer, then you don't need to worry about it.
Okay, it's not always that both breasts are of the same size.
Right.
So does the size make a difference, in older women or women past 40 years?
The it's not as much the size, but the
Yeah.
density of the
Oh, I
breast
see.
tissue.
Yeah.
Because some women tend to have more glandular, fibroglandular breast,
Yeah.
which is dense tissue, which makes it difficult on the mammogram.
Oh, I see.
Because on the mammogram, the normal tissue, which is thick,
Yeah.
could hide small
Tissues.
cancer in there.
I see, yeah.
So in questionable cases, that's why we recommend either combining it with ultrasound of the breast, or in some difficult cases where we suspect there may be something going on,
Yeah.
then do an MRI of the breast.
MRI. So the MRI is more diagnostic compared
Right.
to the
Yeah. MRI gives a better, more information, but obviously we cannot use it as a routine.
Yeah.
It's got to be used in selected circumstances.
So when would you use radiation, or do you use radiation for breast cancer?
Yeah, no, radiation is an important part of the
Yeah.
treatment with breast cancer, but radiation is a localized treatment.
I see. Uh-huh. Yeah.
So it is for local control. So for women who have partial mastectomy or who have
I see, yeah.
lumpectomy, they may have small focus of cancer in some other part of the breast.
I see.
So that's the reason
I
they
see.
need to have radiation
yeah.
to kill off any microscopic cells that may be there and minimize the risk of local recurrence.
I see. Yeah.
Radiation also has a role in more advanced breast cancer, which tends to spread to the bones,
I see. Yeah.
and it can be very painful.
Yeah.
So radiation can be used to give to those areas which have painful bone metastasis
I
for
see, yeah.
palliation of pain.
Yeah. So once they have been diagnosed, they had surgery, they have been treated. How often they need to be checked to see if there is recurrence or if there is worsening of the condition?
Yeah. Yeah, I tell the patients in the first 5 years
Yeah.
after they should still be checked once every 3 months or so.
I see. Yeah.
That is the time when we can do the blood test, like chemistry profile. We can do tumor markers.
Yeah.
There are some tumor markers which help us if the level of the tumor marker in the blood is rising,
Yeah.
that there may be something going on. And then periodically we will get scans, whether it's CAT scan or X-rays,
Yeah.
to see that there is no sign of recurrence. After the 5 years, I
Yeah.
tell them at least once a year.
So, what are the hopes of a 45-year-old young executive lady who has been diagnosed to have a breast cancer leading a normal life?
Yeah, I think the chances of a person like that leading normal life are very good if it
Yeah.
is picked up in the early stage where the patient had the surgery,
Yeah.
had the local treatment, had whatever preventive treatment was given, either whether it's chemotherapy or hormone
Yeah.
treatment, then their prognosis is pretty good and they should be able to lead a normal life.
That's fascinating. Any final thoughts, Arvind?
No, the main message that I want to give is just awareness.
Awareness,
To being aware that nobody is immune to developing breast cancer. It's not somebody else
That's
who
it.
had it.
Yeah.
Can happen to anybody.
So, anybody over the age of 40 years, you would
Yes.
definitely suggest getting a mammogram.
Yes, and anybody with a history of
Yeah.
ovarian cancer or breast cancer in the family, they have to be extra careful.
Extra careful. Yeah.
Yes.
Arvind, it's been a pleasure talking to
Thank-
you. It's
thank
been
you
a
very
pleasure.
much.
And ladies and gentlemen, you have been listening to NIK NIKAM Network Talk Show. I am Dr. NIK NIKAM, and my special guest has been Dr. Arvind Bhandari, who is a cancer specialist. Let's give out your contact information and phone numbers in case somebody has. Sometimes people don't like to call on radio stations and ask very sensitive questions.
Yeah, it's with the Texas Oncology Cancer Center at 1350 First Colony Boulevard in Sugar Land. Our office number is 281-277-5200.
Thank you, Arvind. It's
Thank
been
you,
a pleasure.
Nick.
And
My pleasure
we'll
to be
meet
here,
again.
and you run a very good show.
Oh, thank you.
Okay.
This microphone. Okay, ladies and gentlemen, let me take a little break and we come back and we're going to wrap up. We got 5 more minutes left. Let's see.
Ladies and gentlemen, please visit All India Radio Facebook page and like it. Here we bring you news, information,